Okay, so now let's start talking about pelvic health. So I watched your previous webinar in the McKenzie Institute about pelvic pain, and I know that you use the MDT classification and apply it to pelvic floor patients. So just could you tell us a little bit more about that? I know you've been innovating in this area, so just tell us how all of that started and what have you been doing?
I started practicing in pelvic health about, let's say, about 8 years ago when I graduated. So at the moment, I start treating only female urinary incontinence. So that's how I start, And probably that's most people they start, They start from treating incontinence, and then with experience they start to treating pain. So, but there are not a lot of male physiotherapists actually practicing in the field. So it's quite a challenging field. You talk about a lot of, sensitive topics, you share about, intimacy with your patient. And many people, they don't feel really comfortable to share these stories to a male therapist. So at the same time, I fall in love with, McKenzie method at the moment. I think we call that, and it's MDT approach now. So I just feel this is an amazing tool, to use in my musculoskeletal conditions. For example, a lot of, extremity pains quickly resolved by repeated spinal movement. So this is quite amazing. And in the literature, you can see people aware about the spinal influences in the pelvis. There's many researchers done already. They talk about intra-abdominal pressure, back pain linked to pelvic floor dysfunctions. But in the practice, we don't really look deeply. Basically, we do a range of motion testing for the back and try to say, hey, there is nothing wrong with the back. Or either we feel something wrong with the back, and we don't know, whether this is related to the pelvic symptoms or not. So then that I start to incorporate MDT in the pelvic practice, and just so amazing, you see more and more changes basically with spinal repeated movement. And most of the patients, actually, that's what is my practice state now. Like most of my patients actually don't have to do an internal pelvic floor examination and do pelvic floor treatment. So they were quickly resolved by treating the spine. And we are currently conducting a reliability study, and it's finished the data collection. We are on the way to do the data analysis. And I think it's a quite exciting result. And we can see through the 3 physiotherapists, we all use MDT approach in the pelvic practice. We quite reach a good agreement on the classification, and also about 50% of the pelvic case makes both men and women actually are a spinal derangement.